Brought to you by WikiVidi documentaries. Paracetamol. Paracetamol, also known as acetaminophen or APAP, is a medication used to treat pain and fever. It is typically used for mild to moderate pain relief. Evidence for its use to relieve fever in children is mixed. It is often sold in combination with other ingredients such as in many cold medications. In combination with opioid pain medication, paracetamol is also used for more severe pain such as cancer pain and pain after surgery. It is typically used either by mouth or rectally, but is also available intravenously. Effects last between 2 and 4 hours. Paracetamol is generally safe at recommended doses. Serious skin rashes may rarely occur, and too high a dose can result in liver failure. It appears to be safe during pregnancy and when breastfeeding. In those with liver disease, it may still be used, but in lower doses. Paracetamol is classified as a mild analgesic. It does not have significant anti-inflammatory activity and how it works is not entirely clear. Paracetamol was discovered in 1877. It is the most commonly used medication for pain and fever in both the United States and Europe. It is on the World Health Organization's list of essential medicines, the most effective and safe medicines needed in our health system. Paracetamol is available as a generic medication with trade names including Tylenol and Panadol among others. The wholesale price in the developing world is less than 1 US cent per dose. In the United States it costs about 4 US cents per dose. Fever. Paracetamol is used for reducing fever in people of all ages. The World Health Organization recommends that paracetamol be used to treat fever in children only if their temperature is greater than 38.5 degrees Celsius. The efficacy of paracetamol by itself in children with fevers has been questioned, and a meta-analysis showed that it is less effective than ibuprofen. Pain. Paracetamol is used for the relief of mild to moderate pain. The use of the intravenous form for pain of sudden onset in people in the emergency department is supported by limited evidence. Osteoarthritis. The American College of Rheumatology recommends paracetamol as one of several treatment options for people with arthritis pain of the hip, hand, or knee that does not improve with exercise and weight loss. A 2015 review, however, found it provided only a small benefit in osteoarthritis. Paracetamol has relatively little anti-inflammatory activity, unlike other common analgesics such as the NSAIDs aspirin and ibuprofen. But ibuprofen and paracetamol have similar effects in the treatment of headache. Paracetamol can relieve pain in mild arthritis, but has no effect on the underlying inflammation, redness, and swelling of the joint. It has analgesic properties comparable to those of aspirin, while its anti-inflammatory effects are weaker. It is better tolerated than aspirin due to concerns about bleeding with aspirin. Low back pain. Based on a systematic review, paracetamol is recommended by the American College of Physicians and the American Pain Society as a first-line treatment for low back pain. In contrast, other systematic reviews have concluded that evidence for its efficacy is lacking. Headaches. A joint statement of the German, Austrian, and Swiss headache societies and the German Society of Neurology recommends the use of paracetamol in combination with caffeine as one of several first-line therapies for treatment of tension or migraine headache. In the treatment of acute migraine, it is superior to placebo, with 39% of people experiencing pain relief at 1 hour compared with 20% in the control group. Dental use. NSAIDs such as ibuprofen, naproxen, diclofenac are more effective than paracetamol for controlling dental pain or pain arising from dental procedures. Combinations of NSAIDs and paracetamol are more effective than either alone. Paracetamol is particularly useful when NSAIDs are contraindicated due to hypersensitivity or history of gastrointestinal ulceration or bleeding. It can also be used in combination with NSAIDs when these are ineffective in controlling dental pain alone. The Cochrane Review of Preoperative Analgesics for additional pain relief in children and adolescents shows no evidence of benefit in taking paracetamol before dental treatment to help reduce pain after treatment for procedures under local anesthetic. However, the quality of evidence is low. Other The efficacy of paracetamol when used in combination with weak opioids improved for approximately 50% of people, but with increases in the number experiencing side effects. Combination drugs of paracetamol and strong opioids like morphine improve analgesic effect. The combination of paracetamol with caffeine is superior to paracetamol alone for the treatment of common pain conditions including dental pain, postpartum pain, and headache. Patent ductus arteriosus. Paracetamol is used to treat patent ductus arteriosus, a condition that affects newborns when a blood vessel used in developing the lungs fails to close as it normally does, but evidence for the safety and efficacy of paracetamol for this purpose is lacking. Nonsteroidal anti-inflammatory drugs, particularly indomethacin and ibuprofen, have also been used, but the evidence for them is also not strong. The condition appears to be caused in part by overactive prostaglandin E2, signaling primarily through its EP4 receptor, but possibly also through its EP2 and EP3 receptors. Adverse effects. Healthy adults taking regular doses of up to 4,000 mg a day show little evidence of toxicity. They are more likely to have abnormal liver function tests, but the significance of this is uncertain. Liver damage. Acute overdoses of paracetamol can cause potentially fatal liver damage. In 2011, the U.S. Food and Drug Administration launched a public education program to help consumers avoid overdose. Warning: acetaminophen can cause serious liver damage if more than directed is used. In a 2011 safety warning, the FDA immediately required manufacturers to update labels of all prescription combination acetaminophen products to warn of the potential risk for severe liver injury, and required that such combinations contain no more than 325 mg of acetaminophen. Overdoses are frequently related to high-dose recreational use of prescription opioids. As these opioids are most often combined with acetaminophen, the overdose risk may be heightened by frequent consumption of alcohol. Paracetamol toxicity is the foremost cause of acute liver failure in the Western world and accounts for most drug overdoses in the United States, the United Kingdom, Australia, and New Zealand. According to the FDA, in the United States there were 56,000 emergency room visits, 26,000 hospitalizations, and 458 deaths per year related to acetaminophen-associated overdoses during the 1990s. Within these estimates, unintentional acetaminophen overdose accounted for nearly 25% of the emergency department visits, 10% of the hospitalizations, and 25% of the deaths. Paracetamol is metabolized by the liver and is hepatotoxic. Side effects are multiplied when combined with alcoholic drinks, and are very likely in chronic alcoholics or people with liver damage. Some studies have suggested the possibility of a moderately increased risk of upper gastrointestinal complications such as stomach bleeding when high doses are taken chronically. Kidney damage is seen in rare cases, most commonly in overdose. Skin reactions. On August 2, 2013, the U.S. Food and Drug Administration issued a new warning about paracetamol. It stated that the drug could cause rare and possibly fatal skin reactions such as Stevens-Johnson syndrome and toxic epidermal necrolysis. Prescription-strength products will be required to carry a warning label about skin reactions, and the FDA has urged manufacturers to do the same with over-the-counter products. Asthma. There is an association between paracetamol use and asthma, but whether this association is causal is still debated as of 2017. Certain evidence suggests that this association likely reflects confounders rather than being truly causal. A 2014 review found that among children the association disappeared when respiratory infections were taken into account. As of 2014, the American Academy of Pediatrics and the National Institute for Health and Care Excellence continue to recommend paracetamol for pain and discomfort in children, but some experts have recommended that paracetamol used by children with asthma or at risk for asthma should be avoided. Other factors. In contrast to aspirin, paracetamol does not prevent blood from clotting, and thus may be used in people who have concerns with blood coagulation. Additionally, it does not cause gastric irritation. However, paracetamol does not help reduce inflammation, while aspirin does. Compared with ibuprofen, whose side effects may include diarrhea, vomiting and abdominal pain, paracetamol has fewer adverse gastrointestinal effects. Unlike aspirin, paracetamol is generally considered safe for children, as it is not associated with the risk of Reyes syndrome in children with viral illnesses. If taken recreationally with opioids, there is weak evidence suggesting that it may cause hearing loss. Overdose. Untreated paracetamol overdose results in a lengthy, painful illness. Signs and symptoms of paracetamol toxicity may initially be absent, or non-specific symptoms. The first symptoms of overdose usually begin several hours after ingestion, with nausea, vomiting, sweating, and pain as acute liver failure starts. People who take overdoses of paracetamol do not fall asleep or lose consciousness, although most people who attempt suicide with paracetamol wrongly believe that they will be rendered unconscious by the drug. The process of dying from an overdose takes from 3-5 days to 4-6 weeks. Paracetamol hepatotoxicity is, by far the most common cause of acute liver failure in both the United States and the United Kingdom. Paracetamol overdose results in more calls to poison control centers in the US than overdose of any other pharmacological substance. Toxicity of paracetamol is believed to be due to its quinone metabolite. Untreated overdose can lead to liver failure and death within days. Treatment is aimed at removing the paracetamol from the body and replenishing glutathione. Activated charcoal can be used to decrease absorption of paracetamol if the person comes to the hospital soon after the overdose. While the antidote, acetylcysteine, acts as a precursor for glutathione, helping the body regenerate enough to prevent or at least decrease the possible damage to the liver. A liver transplant is often required if damage to the liver becomes severe. NAC was usually given following a treatment nomogram, but the use of the nomogram is no longer recommended as evidence to support the use of risk factors was poor and inconsistent, and many of the risk factors are imprecise and difficult to determine with sufficient certainty in clinical practice. NAC also helps in neutralizing the imidoquinone metabolite of paracetamol. Kidney failure is also a possible side effect. Until 2004, tablets were available that combined paracetamol with an antidote to protect the liver in case of an overdose. One theoretical, but rarely if ever used, option in the United States is to request a compounding pharmacy to make a similar drug mix for people who are at risk. In June 2009, a U.S. Food and Drug Administration Advisory Committee recommended that new restrictions be placed on paracetamol usage in the United States to help protect people from the potential toxic effects. The maximum dosage at any given time would be decreased from 1,000 mg to 650 mg, while combinations of paracetamol and opioid analgesics would be prohibited. Committee members were particularly concerned by the fact that the then-present maximum dosages of paracetamol had been shown to produce alterations in hepatic function. In January 2011, the FDA asked manufacturers of prescription combination products containing paracetamol to limit the amount of paracetamol to no more than 325 mg per tablet or capsule and began requiring manufacturers to update the labels of all prescription combination paracetamol products to warn of the potential risk of severe liver damage. Manufacturers have 3 years to limit the amount of paracetamol in their prescription drug products to 325 mg per dosage unit. In November 2011, the Medicines and Healthcare Products Regulatory Agency revised UK dosing of liquid paracetamol for children. Pregnancy. Experimental studies in animals and cohort studies in humans indicate no detectable increase in congenital malformations associated with paracetamol use during pregnancy. Additionally, paracetamol does not affect the closure of the fetal ductus arteriosus as NSAIDs can. Paracetamol used by the mother during pregnancy is associated with an increased risk of childhood asthma. It is also associated with an increase in ADHD, but it is unclear whether the relationship is causal. A 2015 review states that paracetamol remains a first-line recommended medication for pain and fever during pregnancy. Despite these concerns. Mechanism of action. The mechanism of action of paracetamol is not completely understood. Unlike NSAIDs such as aspirin, paracetamol does not appear to inhibit the function of any cyclooxygenase enzyme outside the central nervous system, and this appears to be the reason why it is not useful as an anti-inflammatory. It does appear to selectively inhibit COX activities in the brain, which may contribute to its ability to treat fever and pain. This activity does not appear to be direct inhibition by blocking an active site, but rather by reducing COX, which must be oxidized in order to function. It also appears that paracetamol might modulate the endogenous cannabinoid system in the brain through paracetamol's metabolite, AM404. AM404 appears to inhibit the reuptake of the endogenous cannabinoid/vanilloid anandamide by neurons, making it more available to reduce pain. AM404 also appears to be able to directly activate the TRPV1, which also inhibits pain signals in the brain. Pharmacokinetics. After being taken by mouth, it is rapidly absorbed by the gastrointestinal tract. Its volume of distribution is roughly 50 liters. The concentration in serum after a typical dose of paracetamol usually peaks below 30 micrograms/ml. After 4 hours, the concentration is usually less than 10 micrograms per milliliter. Paracetamol is metabolized primarily in the liver, into toxic and non-toxic products. 3 metabolic pathways are notable. All 3 pathways yield final products that are inactive, non-toxic, and eventually excreted by the kidneys. In the 3rd pathway, however, the intermediate product NAPK is toxic. NAPK is primarily responsible for the toxic effects of paracetamol. This constitutes an example of toxication. Production of NAPK is due primarily to 2 isoenzymes of cytochrome P450, CYP2E1 and CYP3A4. At usual doses, NAPK is quickly detoxified by conjugation with glutathione. Chemical properties. Paracetamol consists of a benzene ring core, substituted by one hydroxyl group and the nitrogen atom of an amide group in the para pattern. The amide group is acetamide. It is an extensively conjugated system, as the lone pair on the hydroxyl oxygen, the benzene pi cloud, the nitrogen lone pair, the p orbital on the carbonyl carbon, and the lone pair on the carbonyl oxygen are all conjugated. The presence of 2 activating groups also make the benzene ring highly reactive toward electrophilic aromatic substitution. As the substituents are ortho, para-directing and para with respect to each other, all positions on the ring are more or less equally activated. The conjugation also greatly reduces the basicity of the oxygens and the nitrogen, while making the hydroxyl acidic through delocalization of charge developed on the phenoxide anion. Paracetamol is part of the class of drugs known as aniline analgesics. It is the only such drug still in use today. It is not considered an NSAID, because it does not exhibit significant anti-inflammatory activity. This is despite the evidence that paracetamol and NSAIDs have some similar pharmacological activity. Brought to you by WikiVidi documentaries. Would you like